Top of the mind, one thinks of tourism as a visit to attractive sites for leisure. What if these tourists visited for medical reasons? Medical tourism, as it's called, is slowly becoming a popular phenomenon in Kenya.
Medical tourism is becoming a very interesting part within the health sector, where patients are getting more aware about the quality of treatment available globally and the skills and the kind of professionals that are providing services in this sector. So when the patients are becoming more aware and have more choices, they have now opportunities and options to travel for medical treatment so as to get the best quality treatment at an affordable price. So in the last sort of 5 to 10 years, there has been a significant growth of medical tourism and medical travel in this part of the world.
Joyce Njombi has benefited from medical travel. She underwent a specialized heart operation overseas facilitated by Abercrombie & Kent, a global medical tour company.
When we came here, they were able to attend to us and they told us it was possible to get immediate treatment so long as we get the cash that they told us. So they gave us about 5 options of hospitals, and we were able to choose one that we were able to afford, that we are comfortable with.
We actually help you to choose the whole package and give you the option of where to go, who to pick, and the variety that you get out of that. You also get exposed to the different kind of options, cost-wise as well as the quality-wise and the experienced specialist plus the care itself.
According to McKinsey & Company, global expenditure on medical tourism stands at $100 million. South Africa is the leading destination as it boasts of over 95% formal medical coverage. Depending on the procedure, medical expenses could be 30 to 50% cheaper compared to those in the home country.
Kenya is becoming a more cost-effective place in terms of some of the skilled services it's been offering. If you look at appendectomy or you look at laparoscopic surgery and keyhole surgeries, we weren't doing them a few years ago. Today we're doing many of them. The costs initially were much higher. Now we brought the cost down. So as the numbers grow, the number of skilled personnel who learn these techniques grow, the equipments that we buy are now available, the cost gradually comes down. But you can't compete ourselves with nations that are dealing with 1 billion residents or plus and try and see that we ever will reach that kind of cost effectiveness.
In recognizing the need for a healthy nation, healthcare is Kenya's social pillar as outlined in the Vision 2030 blueprint. The country's goal is to be the most preferred regional provider of quality healthcare. Recently, there has been an influx of tourists who come to Kenya seeking medical attention with a mix of pleasure.
Well, interestingly enough, we've had patients coming down from Rwanda, Burundi, Uganda, South Sudan, Somalia, Ethiopia, a few from Tanzania as well, into Kenya. They consider Kenya as the top healthcare provider over here. And we have a few, those who can afford, who actually travel out. So far we've seen many people go towards the eastern side, and a few have been treated from sides of India, Thailand, etc.
If you look at the kind of patients that we've treated over the last 10 years, we have recorded close to 22 countries that have visited Kenya for treatment. 6 or 7 countries around our region use us in a very high proportion. But in the East and Central Africa region, we are actually very proud of the kind of services that we've been able to offer from the private sector, from our leading facilities in Nairobi, and with our leading skilled specialists in the healthcare scenario.
In the long run, health experts agree that skilled personnel and specialized healthcare equipment is critical to ensure that Kenya positions itself as the most preferred healthcare destination in Africa. For Ion Kenya, I am Laban-Cliff, Onserio.